with a plastic surgeon. And I didn't want to say this in front of other of our bus mob surgeons. They're all wonderful. I enjoy all of the lives, but I'm the most excited for this one. I'm sorry, personally. And I get these questions DM'd to me every single day because we're
Same,
going to
same.
cover a lot of, I bet you do. Dr. Singh from Amelia Aesthetics in Raleigh is here, facial surgery expert. And even though Bust Mob was kind of technically, started with the idea of boobs, Bust Mob, it has definitely evolved into a lot more than that. And so these are questions that, we're not the authority on, and you are. And so I love even the topic of this talk was kind of like, where do med spa treatments, to me, it's like, how far can a med spa treatment take you?
Exactly.
But then, because, even 20 years ago, none of these things even existed really. And
For sure.
so there's a lot you can do, but then there also is a time, and that time is for me. That time is currently now for me. On like, okay, let's talk about surgery or a more
Right.
permanent idea. And financially, you
Yeah,
can get
yeah, yeah, for sure.
Botox every quarter of your life, or you can try something else. So I am really excited to talk about this with you.
I'm so, first of all, excited to be here. Thankful to talk to you, right? And I think what you said is exactly true. It's like two hands that hold or wash each other, right? Like there's a med spa and then there's what I do, and we actually work together quite a bit. Patients before they do anything with me, they see me. After they do stuff with me, they see them, and really, it's an ongoing sort of continuous improvement upon each other, and that's how you get the best results. I think that in the olden days of only doing med spa stuff or only doing surgery are over.
Yeah.
To get the best results, you have to be able to do both together. And ultimately, we have a great med spa here, which I'm thankful for because the providers downstairs are amazing and they work very well with all of our patients to give them the best care.
I will screw up this analogy, but Dr. Davis used to say something like, "Well, it was about tools," and he's like, "If they
Right,
only have one tool, if they only have a hammer, everything is a nail or whatever." I
right,
am
right,
very
right.
proud that we have a med spa as well as surgeons attached to it. Is there like if somebody doesn't is med spa as a whole? I don't even know if people totally understand what the definition of a med spa is.
Mhm.
But then should you shy away from places that are a med spa with no surgeon? Like, are they always
Right.
gonna try to sell you the eye cream because they
Sure.
don't have anything else to talk about? What do you think about med spas in general like that?
So I think this is a fantastic question. It's very relevant. This is something that
Mm,
is a hot topic in social media and society overall. Is this boom that we've seen of med spas? And
mhm,
truly, in my opinion, right? So take this as a biased surgeon, perhaps. I think that a well-run med spa should have a medical director. Okay, and a
mhm,
medical director is optimally not only a physician that can oversee, clearing off people medically to get the treatments, but should ultimately be a surgeon that can also be
mhm,
in the toolbox of what's provided, right? So if you're a well-run med spa, you should be able to cover, the gamut of all the treatments, but then also have this extra ace up your sleeve being like, hey, you've kind of maxed out, or there might be a better option for you, or there might be something you need just a little bit stronger, which needs a more intense intervention, in which case we have a surgeon here that can help you with that, right? And I think that truly is a well-run med spa. There's plenty of med spas that are out there that are being run successfully and provide really good patient care. I'm not here to bash on them, but I will say that, in my opinion, as a surgeon, having that relationship with someone that can provide surgical services and someone that you trust makes a med spa even that much better.
I feel like everyone can be more honest that way too. Like, I want my Botox provider to be like, okay, I can help with this, but
Right.
it's not gonna lift and it's not gonna last. But that might be all you're looking for.
Sure.
But here's another option. No pressure
Absolutely.
either way you want to go, but I'd rather have a choice,
I absolutely agree with
obviously.
that. Absolutely agree with that.
Because I mean, the med spa stuff can honestly be, if not more expensive, just as expensive when it comes to surgery. So I won't have all the prices. I'm not great at that. You do not want me answering
Right.
them, but if
Right.
anybody wants to DM us, we will try to help answer that. But yeah, because you could spend a ton of money at a med spa. You could start in your 20s with
Right.
skincare, and then you could start late 20s, early 30s with Botox and go on. But at what point do you think it's a good idea to kind of pause and maybe get an opinion from a surgeon, because usually the
Sure,
skincare and
sure.
Botox to me are like the gateway drug. At least they were for me.
Right, 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 right. So I think that all goes back onto what you just asked previously, which is what makes a good med spa. So in my opinion, our providers here, I'm going to do a shameless plug because I think they're all fantastic down there. And I'm not just selling the med spa. I actually truly believe this are the people that work down there because I see them all the time, right? I think that a good med spa provider is someone that has very good anatomical knowledge of the area that they're treating, right? And so what that means is that not only do they know how their interventions are working on that anatomy, but also then what can be done further with that anatomy, and thereby when they should recommend a surgeon, right? And so, you asked the question of when is med spa kind of reaching its limit, and then when should surgery come into play? And I don't think there's a sort of thing where you burn all the bridges of med spa and then you go to surgery. I think
Mhm.
that a well-run med spa, especially if a good plastic surgeon relationship, should be able to be like, hey, I see that you're coming here. Let's just make a very simple example, okay? Brow Botox to elevate the corners of your brows. Like, hey, you come here every 4 to 6 months, you get brow Botox, you're happy with it, and it's working. Maybe it's slightly decreasing each time we do it, but it's still working. It's giving you good results. But perhaps you may want to talk to our surgeon to see if there's another option for you that can thereby then give you that result, or maybe even a more long lasting result that instead of having to come here every 4 to 6 months for this treatment, right?
Mhm.
If I was a customer of that med spa, I would feel like, wow, this place really cares about me because they're basically saying, hey, we're going to give away this money that we would have gotten from you every 4 to 6 months, but we want you as the patient, as the customer, to get the best result. So here's an option for you, right? And to me,
Mhm.
like that would buy my loyalty, right? Because I'd be like, this place is
Mhm.
amazing. They're literally showing me an option that I might actually prefer and might give me longer lasting results. So
Mhm.
that's what I think makes a good med spa.
Well, and since you brought out that Botox topic specifically, and by Botox, I usually mean anything that's a
Yes,
neurotoxin. I
neurotoxins.
just use it.
Right,
It's
right.
become Kleenex. I prefer Daxify personally,
Absolutely.
but
Same.
since
That's
you
what I
said
use.
it,
Daxify. Right.
I don't know anyone who's getting 4 to 6 months, anymore with their
Yeah, yeah.
Botox. I feel like I noticed it starting around 2019, 2020,
Sure.
that everybody's resistance to toxins seemed to start building.
Yeah.
Nobody can say that's true. Of course, nobody has fully studied it, but like that does seem to be happening. Are you seeing
Right.
that? And then yeah, you're adding up $1,000 every 2 or 3 months sometimes.
Right.
Well, then I
Right. Right.
finally
Right.
did my brow lift. That was 10. Like I just saved
Sure.
myself. This is girl math, but also, yeah.
Yeah, I hear
Talk to me about
you.
tox resistance and
Sure.
then what a brow lift does instead.
Perfect. 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 Okay. So brief history on Botox. Okay. And once again, when I use the word Botox, I mean to encompass all neurotoxins or neuromodulators. That includes like Xeomin, Doxify, Botox, Dysport, and like you said, it's just become Kleenex, right? Like we mean facial tissues,
Mhm.
but we say the word Kleenex. Okay. So when we talk about neurotoxins, their history is pretty long running. Like in the late 1800s, it was first discovered in Germany, did for a lot of medical reasons, and then in 1970s they started using it in eyelid spasm, blepharospasm, right? And then it wasn't until the early 2000s, around 2002, that we finally made the leap into the cosmetic realm. Okay. And that's after a long period of studying it, making sure it was safe, making sure it was effective. So then when we did 2002, we applied it for the 11s, right? I have very strong 11s. I like glare all surgery long. And so I have to do my 11s. Otherwise, I would have
Mhm.
giant troughs in my forehead, right? And then in 2013, we went to the crow's feet. And then in 2017, we really expanded it to many more things, forehead lines and platysmal banding and all this sort of thing, right? Lip flips. Okay, I'll talk to you about all that stuff too. So that's just the brief history of Botox. And the way that Botox really works is this: it is a medication that stops muscle activation. Okay. The entire muscular anatomy is a series of muscles that contract and shorten and thereby cause changes to our facial structure. They're mimetic muscles, which means they move and express, emotions, speech, blinking, all this sort of stuff. So that's how Botox works is that you inject it in clever areas and it stops those muscles from contracting and thereby having different effects on our face. So 2002, we decided let's inject into our glabella, which are our 11s, right?
Hmm.
So you stop doing this and you stop making
Hmm.
heavy furrows in your forehead. So that's the very first usage in cosmetics. And then we expanded forehead lines, right? Mine's starting to come back. I need to go see Bo, right? And so see, you're very nice. And so um, depending on where you place your Botox, it will adjust how strong your frontalis muscle is activating and causing forehead lines. Okay. So if we understand this and we understand good facial anatomy, then we can use it very cleverly. So if we talk about Botox for brow lifts, you have to understand that the muscle that closes the eye is a circular muscle that starts here, goes all the way around, and inserts back here. All right. It's called orbicularis oculi, circular eye muscle. And so if I target certain areas of that ring of muscle, I can cause certain effects. If I go here at the very side of it, I don't get crow's feet anymore because I stopped that part of the muscle from working. If I go slightly higher, right here, right underneath the tail of the brow, and I inject it there, then that doesn't pull down on the tail of the brow as that muscle closes like a camera shutter, and then you get a brow lift. So that's how cleverly done Botox can cause changes in anatomy of our face, right? So what is a neurotoxin brow lift? It's numbing up this area of the orbicularis oculi that would otherwise hold down on the tail of the brow and letting it relax and lift up. That's it. Okay. Over time, what does happen is that either the muscles or the patient or just the systemically, we get immune, let's say, to the medication. Okay. Your body sees it and it doesn't respond as strongly as it would otherwise. So what can you do? Well, you can either go up in the number of doses, right? Units, or you can try a different formulation. And the reason why so many of those formulations exist is because it's still the same active ingredient, but the way that it's bound to its other coupler or carrier proteins varies. And so sometimes when you switch a brand, your body can't recognize it as the same medication and you get a different effect per se. Okay. Not all the formulations work for everybody. I mean, we have plenty of people that, they can't get A, B, and C, but D works for them, for instance. And so sometimes it's trial and error. And your question, which is long-winded to say that, do you feel like resistance is building? I think that more and more people are using neurotoxins and we're using them for longer spans now, right? Because people are starting earlier. And sure, I would say that if you look at it that way, the lead time is much longer and people are beginning to develop a sense of resistance. But the nice thing is that the market makes up for it. There's 4 or 5 good options right now. You could always try a different brand that might work, that might give you a different or better result.
No, you make up for it. You're helping us
Well,
by being able to give us a surgical option. I feel like, I don't know whether I told myself this or I swear the industry did, that no, if you get it over time,
sure,
your muscles will atrophy. Which is what I
sure,
told myself. Like in
sure.
theory, I'm like, I should have no movement in my face. I've been getting it for 22 years
Right.
and I got all the movement. So,
I know, I know, I
I've
know.
debunked that one. But I think and then I went the brow lift route.
Yeah,
Um, when it comes to under eyes,
very good
I
question.
think people are often, because you mentioned here and you mentioned here, and this muscle goes all the way around, but everybody right now is like, but what about all of these are little wrinkles? And I'm like,
Hmm.
well, you can't really do Botox there. And,
Yeah,
then you can talk about there's lasers and
yeah,
all kinds of things when it comes to under eye area.
sure, 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 sure.
What's the stair step up there?
Perfect. Okay, so the under eye is an area that I work in a lot, right?
Mhm.
At least I operate minimum 2 days a week, sometimes 3 days a week, and at least one of those days I have 1 to 3 cases where I'm doing under eye work. Okay, so it's an area that is nuanced in the way that its composition is. So I'll just break it down really briefly, like I do with all my patients. Okay, so it's skin, very, very, very little amount of fat, then the muscle layer, which is that circular muscle, and then the deep fat that lives tucked up all behind it. Okay. So for the under eye, when the deep fat falls forward, that's what we call eye bags, right? We call them festoons. And that's what you get a blepharoplasty for, to remove that extra fat that falls forward. And then you have the muscles that over time, as we age, may need to be tightened. Right? That's why terms like canthopexy, canthoplasty sort of exist. And now we're cleverly doing things to give you like the cat eye look, fox eye look, etc. Right? We're manipulating that muscle cleverly. But then really for the day-to-day individual, what we're talking about are those two top layers, the skin and that thin, thin, thin layer of fat there. All right. In some individuals, that layer of fat is very, very thin, right? People of Southeastern descent, for instance, have very thin layer of fat there. That's why people have dark under eyes. Dark under eyes is the skin laying right on top of the muscle. So when the light punches through skin, it hits red muscle and bounces back dark. That's why we have dark under eyes, right? So what can you do for that area? Well, you can do one of two things. You can either inject something between the muscle and the skin to build up that space so you have less, light hitting red, in which case we're talking about filler, which in my opinion, and I've been set on record for saying this, is not my preferred route. Your own material, which comes in the way of plasma, so PRF, or your own material in terms of fat grafting. Okay, so you can build that up. Or the other option is you can build up the thickness of that skin, right? By building up the thickness of the skin, it also helps to camouflage some of the micro wrinkles and the darkness of the under eye. So how can you do that? Well, dermapen, peels, lasers, all these things help by control trauma to the area, which then heals into thicker, more robust tissue, thereby thicker skin, and it will lead to improvement in the under eye. What you touched upon, which I think is important, is what about Botox? Is Botox good for the under eye? In my experience, I have not seen tremendous effects of Botox in the under eye region. I'll be very honest, right? I think people try to get it to stop that little like banana roll that happens here or to stop the micro wrinkles. And I just don't think that it is a modality that works well in that area. I think the other options are better because they work to augment the anatomy differently.
Mhm. Okay, I got a couple more. And you may not have a good answer for this, but I'm like,
Sure,
if somebody has to start somewhere, how effective are under eye creams? And like, do you have a
sure,
fave?
sure,
Because I
sure,
know
sure,
how I
sure.
usually answer that. Like, often also do the treatment versus skincare.
Yeah,
And I
yeah,
always
yeah.
equate it to like dentist and brushing your teeth.
Sure. I think it's a great
Like
question.
you kind of
Yeah,
need both, but
absolutely.
like, is this gonna change is an eye cream gonna,
Right.
because that's how
Yeah.
it's marketed to us that it's gonna revolutionize our under eyes, and I call bullshit.
So that's a great question. I think that goes back to exactly what I was saying before, which is that you can either do something to the fat or you can do something to the skin. Okay, so we're talking about the skin now. So besides intervention in the med spa, dermapen, peels, or laser, there's your day-to-day things that you can do that also help with skin quality. All right. You know me, I am a strict non-brander, right? I don't push brands because I believe in ingredients. I don't really push a certain brand that may have it because everyone's face is different. The composition of their oil, the composition of their skin type and sensitivities is different. So I am very hesitant to say any brands because what might work for you may be terrible for me, right?
Mhm,
And so what I always say is find the ingredient, the active ingredient, and see which brand works for you. Okay. So
mhm,
um, what really works well for skin of the face and especially the under eye skin? All right. Well, I will tell you what I tell most of my patients, which is that you need four main things for your skin all the time. Number one is a good moisturizer, applied 2 times a day at least. Number two is a good sunscreen. As we know, UV damage is terrible for skin aging, right? And so SPF 35, 50 optimally is the best for skin protection. After that, you need some sort of exfoliant, and chemical exfoliants are the best. And my preference for that would be retinols, right? Because I think retinols are readily available. They come in many different brands, and you just got to find the one that suits you. Of course, getting on a retinol is sort of a journey, right? Because it
mhm,
leads to a lot of dryness and skin sensitivity. So you have to give your body the ability to build up for it. But it's one of the longest studied and most proven treatments for healthy skin in the long run. We've done literally biopsies of skin and stained it and seen that those individuals that use retinol in the long run have thicker, better skin than those that don't, right? And so I
mhm,
think there's no denying the efficacy of retinol. Okay, so we got moisturizer, sunscreen, retinol, and then you need some sort of help in the antioxidant world. So like vitamin C's or HAs, for instance, I think are good to help kind of fill that bucket. All right, so
mhm,
those are my four main buckets that I look at when I tell my patients, all my facelift patients, my neck lift patients, my rhinoplasty patients, my eye patients, about what I want them to do afterwards to maintain the results, I say, hey, you got to get something from each of these 4 buckets. Okay.
Mhm.
And, there's, if you go on TikTok or Instagram, there's like probably 14 billion videos of how to use these things, right? And you just got to find the one that works well for you. Talk to your med spa provider. Heck, even go to Sephora. Like Sephora has really
Mhm.
good samples of things, right? I mean, shameless plug. My wife shops there all the time, and I think it's a good place to go try things. Okay, go to the
Mhm.
mall, try things, and you'll find the ones that work well with your skin, and just stay consistent. The thing about these products is that you're not going to see an overnight change. What you're really doing is that 2025 Greta is paying 2030 Greta a favor by
Mhm.
taking care of it
Mhm.
now, right? That's how you have to think about it, is that you're really building this for the long run.
Yes. Do those little eye patches that I like to wear some mornings work, or am I wasting my money?
I, you know, I personally don't have any data on the eye patches. I'll be honest with
Mhm.
you. If they work, for instance, by causing some level of skin contraction temporarily, sure. I mean, if they work for you and they get you 2, 3, 4 hours of improved under eye, why
Mhm.
not wear them, right? The old
Mhm.
wives' tale about using hemorrhoid cream, for instance, on the under eye to tighten the skin, right? A cold spoon, cold gua sha
Mhm.
pads, sure. If all these things, in my opinion, if they don't cause any damage, and they really just help you get out either some swelling or tighten the skin a little bit, and they work even for say 2, 3 hours, and it's not hurting anything, why not do it? That's fine, right?
Mhm.
I have a problem when people start doing things that may actually be causing damage or
Mhm.
may be causing harm for you in the future. And that's where I kind of pump the brakes and say, hold on, let's wait and think about this.
Mhm.
Are you kind of shortcutting yourself now for
Mhm.
something in the future that may hurt? Okay. And I mean,
Yeah.
obviously, I've talked to you about this before, but like my big things are, high energy to the face, heavy heat to the face, and then things that like threading, for instance, right? You know that my
Mhm.
feeling threads, it leads I've worked on facelifts with people with threads in them. It's like chopping through concrete. It's not in your favor in the long run to do these things.
Yeah. Oh, thank you. We won't touch on the thread thing, but yeah. I say the same thing when everybody
Yeah.
asks me that. Even though now all of a sudden, have you noticed it tapered off again and no one's talking about
Sure.
it again? And they
Yeah.
will be in 5 to 7 years again. It seems like it comes and goes.
Absolutely.
Okay, let's talk about skin tightening for the whole
Sure.
face,
Very
not
good.
just eyes. Because I think we all kind of see that a little bit when we start 20s,
Hmm.
30s, and it's like, oh, okay, I can just some of these, microneedling, or like you mentioned,
Yeah.
I love
Yeah.
microneedling. I'm a big fan. It
Absolutely.
does some subtle skin tightening,
Absolutely.
but then
Absolutely.
all the way up to there's jowling and a facelet.
Yeah.
So
Yeah.
how do you feel about some of these tightening things? Are there some to watch out for? I've heard some
Sure.
can
Sure.
honestly melt the fat in your face,
Yes. Yes.
which we
Yes.
don't want.
Yes.
And then at what point, and I'm about at that point, 50th birthday's coming up and
I hear you.
planning my mini facelift or facelift, I don't care.
Sure. Sure.
Because now you've taught me that I don't have to wait for a
Right. Right. Right.
facelift.
Right. Right. Right.
And so, yeah, talk to me about skin tightening devices
Sure.
versus surgery.
Okay. Very good. So, in general, we must always remember that fat, although we try to get rid of it everywhere else in the body, right? We're all on diets and working out and doing all these things, is precious in the face. Okay. So, you have to save the fat in your face because loss of volume in your face will make you look gaunt and it will thereby then make you also have deeper wrinkles, deeper folds, and all these things. Okay. So, we'll touch on what you said about melting the fat in a little bit,
Mhm.
but skin tightening of the face, once again, I think truly is just effects of thickening the skin, improving its quality, and getting you some improvement in those micro wrinkles and micro changes. Okay. So besides the retinols, I do think things like microneedling, dermapen, microcoring, which is a more aggressive version of microneedling, without the application of heat are good because what they cause
Mhm.
is controlled trauma, right? They either abrade off the top layer or they make small little holes, they aerate in the top layer, and then new tissue grows in from underneath, which is healthier, tighter, firmer, and better. Okay, it increases overall the quality of the skin. So those things think work very well for skin quality. So how can you do that? Chemically, I've already talked to you about this, retinol. Mechanically, that's the things that I just said, right? Dermapen, microneedling, microcoring, or thermally. So how do you do thermally? Lasers. Okay, so lasers are
Mhm.
great for that. I think Halo is a great example of what we have here. You can always go a little bit stronger. You can go like fully ablative CO2, right? That's a little bit longer recovery, but overall, even a better effect from that. And what that does is just a different version of the same philosophy. Okay, is the fact that you're causing controlled injury to the skin, thereby making new skin grow underneath that's firmer and tighter and healthier, and thereby giving you better overall skin quality. Okay,
Mhm.
and the one thing that I think has kind of fallen to the wayside, but really people shouldn't sleep on it, is peels. Right? I think
Mhm.
peels are amazing. I get peels pretty regularly. You and I just talked about this offline about peels, and
Mhm.
there's some really, really good peels out there that can provide you
Mhm.
substantially great results, right? And
Mhm.
so, if you don't have a nearby laser available, or if you want another option where lasering might not be the right option for you because, say, you have underlying melasma where the heat of the laser can activate it and give you
Mhm.
hyperpigmentation, then maybe get a peel, because that might
Mhm.
actually be the best route for you to go. You can still get the same results, just a little bit in a different avenue. All right.
Mhm.
So chemically through retinol, mechanically through dermapen, micro needling, micro coring, thermally through laser, or get a peel. That's, I think, the
Mhm.
best way for total all over face, full face tightening.
Thank you for mentioning the peel thing. I forget. And then also, it can be more cost effective. So thank you
Yeah,
for watching out for us that way. I
absolutely,
just
absolutely.
hate the actual act of peeling for some reason. I feel like I'd rather look
Yeah,
sunburned after a laser, but man, do peels work. Okay. But then you get to be in your upper 40s or
sure.
your young 40s or your 50s or whatever, some of you
Yeah,
blessed people. And there's not, I feel happy with my skin, but that's not
yeah,
touching this. Is that when you start talking about a facelift?
yeah. So when you start seeing real changes to your facial anatomy, right, where volume changes in facial anatomy, right,
Mhm.
flattening of your cheek area, deepening of your temples, really deep nasolabial folds, these little marionette lines, or
Mhm.
jowling in particular,
Mhm.
which is descent of fat from the mid cheek downwards, that's when I think you have to have a conversation truly with your med spa to be like, hey, should I see a surgeon?
Mhm.
Okay. Or go to your local plastic surgeon that you trust. Come to me.
Mhm.
That's when you have a really good conversation about true facial anatomy, what's going on underneath in the actual muscular layer that's causing these issues, and how can we address it, right? Um, I have been seeing patients as early as their late 30s, all the way into the upper 70s, sometimes even early 80s for doing facial work. Okay.
Mhm.
And it really is an opportunity to have a discussion about your individual anatomy and what's going on and why are you seeing these changes. And so jowling, I think, is a great time to be like, hey, maybe I just need to go have a conversation with somebody, because this might be time
Mhm.
for me to learn about what's going on in my face so I can accordingly and appropriately plan what's the next step. My
Mhm.
practice is two buckets of people: 30s and 40s, and then 50s and 60s. The 30s and 40s patients I see usually come to me for changes around the eye, hooded
Mhm.
eye, droopy brow, bags or hollowness of the under eye, and then neck laxity. I see a lot of early necks, and we've been noticing it a lot because now we're on virtual meetings all the time, right? FaceTime, Zoom, all these sort of things. So my 30s and 40s, I do a lot of neck lifts, a lot of eye work. In my 50s and 60s, we're seeing jowling, folds, deepening, flattening, and then they want the full facelift, right?
Mhm.
My job when you come to me is to explain the anatomy to you and make it digestible so you can understand it. And so you realize what it is that's going on in your face. And then you can even understand the surgery of what's happening, right? A lot of what
Mhm.
is the fear of surgery is the smoke and mirrors and the mystery of what's happening. My job is to make that completely go away. I spend
Mhm.
a lot of time here, even before I touch your face, describing anatomy to you so that we have a good common core language. And then we go do an exam. And I think that alleviates a lot of the anxiety of my patients and actually
Mhm.
lets them leave my office much more educated and able to understand what's going on.
Mhm. I don't know if social media, I'm sure it has played a part in it, but I feel like so
Yeah.
much has changed about just the ideas of facelifts in the past five
Right.
years. Even
Right.
from what I knew 15 years ago, Dr. Davis's demo was you only want to have one facelift in your life
Sure.
and you
Sure.
want to wait as long as you can. And
Right.
then you better take a month off.
Yeah.
and
No,
you're
definitely
probably
not.
still going to look pulled this way.
Yep.
And, I was always just like, I'm never doing that,
Yeah.
but now I've seen your patients and they look subtle, but also the recovery seems a lot easier. So can you just give us
Absolutely.
a quick, because I do think that's terrifying for people,
Sure.
at least back in the day, uh, and sometimes you see them on Instagram and things like that, and it's full face, CO2 at the same time,
Yeah.
probably.
Yeah.
And
Yeah.
I mean, they look amazing in a couple weeks, but, you know, a mini facelift or a facelift on, say, a 47-year-old,
Sure.
what would my
Sure. Sure. Sure.
recovery look like?
Okay, so the modern facelift and a well done facelift is working on the muscle layer. All right. I think a lot of the bad facelift results we used to see back in the 90s and 2000s where
Hmm.
people were doing a lot of pulling on the skin or changing the muscles incorrectly. And that would lead to weird appearances, tension lines, tethering, weird changes in facial anatomy, and then that like wind tunnel, like pulled look, right? That's when the skin gets pulled. And that's also when you had really bad scarring because the skin does not heal well when it's under tension. Okay. So now the modern facelift, as we understand facial anatomy, is working on that muscle layer, which lives underneath the skin layer. And that layer is called the SMAS, SMAS, subcutaneous muscular aponeurotic system. And depending on whatever you do with that muscle layer, is all the different terms that you hear. Okay. So you hear
Hmm.
things like SMAS plication, SMASectomy, SMAS stacking, high SMAS, and then deep plane. Okay. These are like the terms that are thrown around all over social media, right?
Hmm.
What I'll say is that depending on what surgeon you go to, they've had experiences with certain types of surgical procedures and they have expertise in those surgical procedures, and they will do their facelift based on that experience. There isn't one that I would outright say is better than the other surgery, right? I do think that in my hands, in my experience, in my training, I do a deep plane facelift and I do a deep plane neck lift. And the way that I do it, I really like my results and I really like my recovery, and so do my patients, right? And so I'm not here to bash on other surgery types because there's certainly certain applications where one actually might be a better choice than the other. So you have to find the surgeon that works best for you. But for my
Hmm.
deep plane facelifts, what I do is that I basically enter the skin, I open it just a limited amount, and then I go right under the muscle layer and I move both the muscle and the skin together as a big sandwich. And that's right.
Hmm.
I don't separate up the two leaflets. And what's nice about that is that all the little blood vessels that go from through the muscle into the skin, they all stay preserved. I don't break any of those. I move them all as a unit. And so then you get less bruising, less swelling, faster recovery, and just a more natural overall appearance to your skin because you don't get that weird sort of matte look that people used to get when you used to do a
Hmm.
big flap of skin and a big flap of muscle underneath, right? So that's why my patients, when I tell them, hey, your recovery is going to look like this, is by 3 weeks, no one's going to know. You can go in society, no one will know you've had any work done. And oftentimes, my patients are out there day 7, day 10, living a normal life, and no one even knows that they've had any work done, quite frankly, right? You might still have some, you will definitely have some redness of your incision line. You wear your hair down, no
Hmm.
one's going to know. When you look at your face, bruising's gone, swelling's pretty much resolved, it's moving naturally. You're a little swollen in places, but overall, it's a pretty natural look. So,
Hmm. That's amazing. And then, okay, I'm glad you brought up the neck thing a little bit because we're moving
mhm,
down the face. And necks, I feel like necks are as frustrating for me when I talk about skincare at the med spa as eyes are. Like, I've
sure,
tried almost everything for my neck. First of
sure,
all, I was going to
sure.
ask you, is there anything non-surgically you like for the neck? So
Yeah.
much of it seems genetic. When I look at my high school photos, I had like this banded neck, and I see it in some
Yes.
people,
Yes.
and other people, damn Angie, not the med spa. I've
Yeah.
never
Yeah.
seen a more flawless
I
neck.
know.
She looks like
I
a
agree.
Barbie.
Right.
But yeah, I'm like, well, of course I'm gonna do my neck at the same. It seems
Of
crazy to
course.
do your
Always.
facelift,
Always.
because I started getting Botox there years
Hmm.
ago. Love it,
Yeah.
but
Yeah.
also I don't want to continue to do that.
Yeah.
So how do you get in there and do that?
Sure. Okay. So for the neck, I think in the broad scope of things, it's the same thing as the face, right? You can do lasers, you can do retinol, you can do peels. It'll do the same sort of thing to the neck as far as
Hmm.
skin quality goes, right? It'll improve skin quality. And then Botox also has applications, right? If you have a very strong platysma muscle that's activating and causing bands and you're young, you can get that hit with Botox, right? That will numb
Hmm.
that area, and that will, in essence, give you a decreased pull of those muscles and decreased banding that occurs there. Okay. So that's on the non-surgical side. In the
Hmm.
long run, what happens and what we find is that the platysma muscles, which are the two main muscles of the neck, they're fan-like. They start at the collarbone and they end right where this dip right before your mouth happens. It kind of they creep up onto your face. Those are the ones that change over time and have changes in the volume underneath them that causes loss of neck contour. Okay. That's why you go from something that looks like this to something that looks like this over time, because they soften and then they also open. It is the
Hmm.
softening and opening that leads to triangulation of the neck, loss of the cervical mental angle, and then kind of a fullness in the center there. All right. What that fullness is that all the stuff that was nice and tight and tucked up there before
Hmm.
now is falling down, right? You have a space
Hmm.
for it to live. And so what I do when I do and I think about my necks is I not only want to tighten those muscles back and create those angles, but I also want to do something about all that volume that lives there. Okay. So I'm a deep neck, I do deep necks, right? I'm a deep neck specialist. And what that means is that I work on everything underneath that muscle level. And what lives up there? Three main things: deep fat, which is congealed and very heavy. You can't liposuction it out. The
Hmm.
minor glands, which are the submandibular glands here, they're not the main salivary glands of the mouth. They produce only a minor amount. And I don't take them out. I just shave them so they sit flush with the bone. And then the muscles that kind of overactivate and take over the responsibility once the platysma weakens, the digastric muscles, they keep firing more and more, and then they bulk up. Just like you go to the gym, you start lifting, your biceps get bigger.
Hmm.
Same thing with those muscles, they bulk, right? So when I do a deep neck, I trim the glands, I trim those muscles so that they're flush again. I trim the heavy fat, and then I tighten the platysma back to where it's supposed to be. So you have a nice, crisp jawline here, a flat neck here, and then I pull them up on the side just like a hammock. I say, sew the hammock in the middle, and I attach to the two trees, and that's what gives that nice, crisp jawline again that everybody wants. You know what I mean? So
And
that's
then you
basically what a
go
deep neck
camping.
is.
It's like you're doing a tummy tuck, you're giving me my tummy tuck
Exactly.
back right here.
Exactly. Diastasis of the abdomen is similar to diastasis of the platysma. So that's exactly what you're saying. Perfect.
Wow, that's wild. I really like the idea of doing the two together too, like why you would do one
Why?
versus
Absolutely. 100%.
another. Okay, I had a couple this or that type
Sure.
things,
Sure, sure,
and
sure.
it shouldn't be this or that because it's not like one is right and one is wrong, but I just mean things like I wrote lip filler, lip
Good.
flip, or
Yeah.
lip lift.
Very good. Okay.
I've had two of the three, and I've asked you about the third, but we'll see. I just am fascinated by the lip explanation that
Yeah.
it gets longer as we age.
Yeah.
And now I can't help but look at every's
Yeah.
length and be like,
Correct.
oh, I see it.
Yeah. 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 For sure.
Damn.
For sure.
So, but okay, yeah, you
Okay.
describe
So
them.
lip filler, lip flip, and lip lift. Okay. So lip
Mhm.
filler, just it's filler. It's
Mhm.
great for volume. Okay. And we can
Mhm.
creatively fill the volume to give you either more red show, more better Cupid's bow, better balance, kind of roll out the edge, the vermilion edge, and give you a better appearance there. Right. So that is lip filler. I personally think lip filler is tremendous. Okay.
Mhm.
What I tell my patients is that when you think about filler versus fat, anything closer to the mouth is better for filler, anything farther away is better with fat. And that really has to
Hmm.
do with the fact of how they kind of work and how they live. Fat just doesn't survive the best in the lips. So I think
Mhm.
filler is a pretty good option for that, quite frankly, right? So I'm not anti filler. I think filler works tremendous in certain settings and I think it's appropriate.
Mhm. Mhm.
So closer to the mouth you are, filler is better. So lip filler is just that. Good for volume, good for shape, and you can good for balancing things to a slight degree. Okay.
Mhm.
Then what is a lip flip? Okay. So just like we have orbicularis oculi, we have orbicularis oris, another muscle. Okay.
Mhm.
Circular oral muscle. And so if you numb with Botox certain areas up
Mhm.
here, it will prevent it from squeezing as tight and you will have more lip show. That's a lip
Mhm.
flip. Okay. And that's good for some individuals that have thinner lips or a really gummy smile. If you have a very
Mhm.
gummy smile, you might actually want to get a lip flip because that'll help numb some of that activating muscle and relax your lip a bit so that you get more lip show and
Mm-hmm.
less gummy show. Okay, so that's
Mm-hmm.
lip flip. And then lip lift, which is what you already talked about, is the distance between the bottom of your nose
Mm-hmm.
to the tip of your lip, right? The philtrum length. That over time, that over
I
time
want that.
gets longer. Okay. And we call that
Mm-hmm.
long lip. I think it's kind of a poorly named thing. I think of long lip this way, but that's not what it is. Long
Yeah.
lip is the distance between your nose to your lip. Okay.
Yeah.
And the lip lift, when done well, hides the incision right in the base of your nose. And just like you were doing, decreases this length. Okay.
Yeah.
And a good way for you to test if you need a lip lift is this: it's called the mirror test for repose. And what that means is you go to the mirror and you stand completely neutral and you just barely open your mouth, just a little bit like, okay. If you can see a third to a half of the middle two teeth, the central incisors, you still have good lip length. If you don't see any of your central incisors, you might want to consider getting a lip lift because that means that your lip is beginning to drop and show a lot of length.
Oh
Okay.
my God, I just did it and I couldn't see.
You
I'm
have
gonna
some,
do this
trust
a
me.
hundred times tonight. Um, does your nose keep growing as you age too, or is that a myth?
So the growth center of the nose is kind of that interface between where the bone and the cartilage starts. Majority of the nose is well developed by the time you're 12 to 15, depending on if you're male
Mm-hmm.
versus female. And does the nose grow over time? I think what really happens is that we get growth of the tissue, right? Not so much of the underlying architecture, the sort
Mm-hmm.
of skin tissue. Certain individuals get, rhymophyma and all these things over time where the skin really thickens. And that's what we really see. And then the
Mm-hmm.
stuff around it shrinks, right? So the
Yes, that's
orbit
what
gets
I was
thinner and
wondering.
we get more
Mm-hmm.
gaunt. And so we think that our nose is bigger because our lips get
Mm-hmm.
thinner, things begin to fall, the eyes get more, sunken in, and then your nose thereby looks bigger. That's, I think, the reality of the
Mm-hmm.
situation.
How come I don't think lip lifts are very popular? Is there a
Sure.
reason for that, or am I wrong?
So I think that lip lifts are done in the right patient, especially my older facelift patients, because I pointed out to them, I'm like, hey,
Mm-hmm.
this is an increased distance. If you look at your photos from you when you were 30, you didn't have this distance, right? And I think we just
Mm-hmm.
don't even notice it as we age. We think that we're losing volume in the lip, when in reality, we're
Mm-hmm.
losing both volume and we're actually increasing length here, right? On the other side, which I think is very important, I'm glad you brought it up, is that I'm getting younger patients that are wanting lip lifts because they think it's that
Mm-hmm.
popular thing that they want to do. And really, those patients are the worst candidates for lip lifts,
Hmm.
not only because one, their anatomy doesn't dictate it, but two, because they actually scar really poorly. You would think that older people scar poorly, but actually, it's the younger
Mm-hmm.
people because their skin is so active and so oily that they
Hmm.
scar really red and really raised under their nose. And they're, in my opinion, some of the worst candidates for lip lifts because I tell
Hmm.
them, one, your anatomy doesn't need it. And two, even though you think I'm younger, I'll scar better, because your skin's so active, you're going to scar poorly for that surgery. And so I say
Wow.
no. I think you'd be surprised. I probably say no once a week to a young individual that comes to me and sits in my office asking for a lip lift. And I'm like,
Mm-hmm.
it's just not warranted. And you're going to
Mm-hmm.
trade a really big red raised scar for
Mm-hmm.
not a good look.
Mm-hmm. Oh my
So
God,
that's
that's I just learned so much about that. I'm still not counting it out, but
no,
that's
but I'm talking about my younger patients. They don't warrant it. I think individuals that, as they enter their
yeah,
40s, 50s, 60s, then you're talking about it's appropriate. But my 20s and
yeah.
30s patients, I don't think that most of them need it.
Do people come in for that alone, or is it just often something that is done while you're doing a full face rejuvenation
Sure,
kind of
sure.
thing?
Two buckets once again. Young patients come in it because they've seen it on
Yeah,
TikTok and they think it's the hot thing to do. And I tell them no.
yeah,
My older individuals that do it with, eyes, necks, faces, then it's
yeah.
appropriate. And I say yes. So really that's how it
Okay,
works.
okay.
Yeah.
I was curious about that one. Okay. I don't even know if Kybella is still much of a thing. I should.
Oh, great
I mean,
question.
I should. I
Yeah.
mean, I did Kybella actually. Kybella, the
Hmm.
fat melting injection
Sure.
under your chin,
Sure. Sure. Sure.
chin liposuction or
Sure.
submental liposuction,
Mhm.
or a neck lift.
Yeah.
All three options. Give me the kind of pros and cons of each one.
Yeah. Perfect. Okay. So, I'm going to make a lot of enemies here right now. Kybella, in my opinion, terrible. I don't recommend it, and I'm glad you had a good experience with it. The reason why is
It was
because
okay.
it's a non-selective melter of fat. Okay, so by that I mean it's not well targeted. It doesn't, it doesn't get to the exactly the area that you wanted to get. It will just melt anything that looks like what it's going for. Okay, which
Mm,
in one aspect is like, sure, it doesn't work well because I can't target it. But in my opinion, the worst side effect of it is this. Yes, it can melt fat, but you know what else is made out of fat? All the sheath linings of your nerves are surrounded in fat. And so I have seen personally at Pittsburgh and then in case reports, individuals that get Kybella treatments and it melts the linings of the nerves in the neck. And then they get skewed of their lips. They can't activate their neck muscles properly, et cetera, sensation loss. And so that to me is the biggest problem with Kybella. It's not so much that, oh, I had to get 6 treatments. It cost me an arm and a leg, and it only did
mm-hmm,
5% of difference. That's fine. You got lucky, right? You wasted
mm,
some money, sure, but you didn't have a serious side effect. I've seen some serious side effects of this stuff, right? And
mm-hmm,
so that's why I personally do not think Kybella is a good option. All right. Not to mention the scarring you're making down the line. If you ever need to get any neck work done, you're kind
mm-hmm,
of, making your future work harder on yourself. Okay. So that's
mm-hmm,
Kybella. And if I've offended somebody, I apologize. All right. So second is neck liposuction. Neck liposuction, I think, works very well if you have selected fat that is contributing to your neck shape that lives below the platysma. Okay, if your platysma is good and tight still, and you just have
mm-hmm,
some fat that lives there, and you have good skin quality, then I think it's appropriate because then you can liposuction that fat out, which I call layer two. And then layer one, which is your skin, will passively retract over time and get you a better shape. What I tell my patients is that I don't get to directly control layer one, your skin. That level of retractions all on you. Your skin quality, your genetics, how much it's going to retract. I can't predict that, right? All I can do directly is evacuate layer two, and then layer one has to go to retractor zone. So I usually say for my patients that if you're above the age of 30, probably
mm-hmm,
neck liposuction is not a good option for you because one, your skin quality is not going to let it retract well. And two, most likely there's more than just layer two that's contributing. You have some level of platysmal weakness and some level of layer four, the deep stuff, the glands, the muscles, the deep fat that's contributing to your neck shape. Okay. So that's where
mm-hmm,
I then go down the avenue of neck lift, which is once again an incision under the chin where I can go in and directly control all four layers, right? Trim the deep fat, trim the glands, trim the muscles, tighten up platysma again, trim layer two, which is what you would normally liposuction, and then put the skin exactly where I want it. And that way I get much more direct control, much more immediate results because I'm not waiting on your skin to retract. And
mm-hmm,
overall, I can just dictate the shape a lot better. And so that's really how I talk to my patients about which avenue they should take, right? Should
mm-hmm.
you get neck liposuction? Should you get a neck lift? Depends on your anatomy, which of the four layers is contributing, and then where you live as far as age ranges go.
Mm-hmm. That makes it very clear what I would want. I want the
Yeah.
safe and snatched, look.
Sure, sure,
But so if someone's just having a neck lift, the incision is only right here,
sure.
or do their
So
incisions back here?
very good question. This is called a short scar neck lift. This is a traditional neck lift. So if you only do this, I can contour all four layers and lay the skin here. If you're someone that I think will have a redundancy of skin, where I think that you're going to have a little bit extra skin left over, then I'll make these incisions to work out the skin and give you an even more tighter look so you don't have some central laxity of the skin left behind. And I
Mm-hmm.
determine that when I see you. And really, it's this incision that's the main one that's the moneymaker because that's what really lets me
Mm-hmm.
get access to all the deep stuff, right? I trim the glands, I trim the fat, tighten the muscles all through here. This is just for a little additional tightening, putting it up on the trees, and then working out the skin as needed.
Mm-hmm. My friend had a neck lift with you, and I could not believe after seeing what happens in the OR, she
Right.
was like she was like, this is pretty nothing. Like
It's
a day
tremendous,
or two
right?
later, I
I
was
agree.
like,
Yeah.
I saw your autopsy, like it was
Yeah.
intense. Okay, filler or fat grafting? I think we've all and I put my hands up
Sure.
because it could be in the hands.
Yeah.
But pros and cons of each one.
Absolutely. Okay. So Filler and fat grafting are both volume addition options. Okay, that's what they do. They're here to contour and add volume. And like I said, in my opinion, the way that I tell my patients, the closer you are to the mouth, the better filler is. The further out you are from the mouth, the better fat is. And why do I say that? Is because of one of two things. Either A, the tissue in which you're injecting it is super thin and you might be able to see the filler. Okay. The under eye is one of those areas that has the thinnest skin of the entire face. If you put filler in there, you can sometimes see the filler. And by that, nodules, sort of lumpy bumpies, unevenness, but something else called the Tyndall effect, which is where light goes through skin, hits blue filler, and bounces back gray. So people have this grayish hue to the under eye. Okay. You don't get that in the lips, right? The lips are nice, red, robust, beefy, and you won't see the filler. All right. And I think it's a very, very good modality there. On the other hand, fat, really good here, really good in the temples, right? Really good in the upper cheek area, not so good in the lips. Why? Because when I do fat grafting, the fat has to initially survive based on the surrounding blood supply. 6 weeks or so is what it takes for the fat to really live on its own. Okay. So the things that kill fat are trauma, thermal trauma and mechanical trauma. Now, mechanical trauma is anytime you move something or rub something, it's going to do that. Think about how many times a day we talk, we smile, we eat, we chew, we do something with the lips, we bite our lips, we whistle, we all, if fat just is, it's not as good in the lips because there's so much trauma. How many times in a day do you activate your temples? 5, maybe. Do you know what I mean? Like, so fat's going to survive amazing there because it's not being traumatized. Okay. So that's what I tell my patients. The closer you are to the lips, a very active area of your face, filler's better. The farther out you are, fat's better. Okay. Why do I like fat? In addition to the fact that it's your own tissue, is that it is nice and yellow, right? And so when you add it under layers of skin, it can brighten those areas, right? Because it will bring a degree of brightness to the area when the light punches through the skin, it bounces back off of yellow things, which is bright. All right. And then the studies show that there are some stem cells that are in the actual fat that will improve the overall surrounding tissue as well. So skin quality can also be improved with fat grafting. So that's why, I'm from University of Pittsburgh, as you know, spent a lot of time there. A lot of work on fat grafting was done there. So I do a ton of fat grafting, every face, under eyes, hands, breasts, all sorts of things I fat graft, and I love it. And so, I'm a little biased. I'm like Dr. Davis, right? Which is that like every carpenter has a nail and always sees the hammer. So, but in my hands, I think it works very well. My patients are very happy with it, and we get good long-term results. And so, fat grafting versus filler, I think both have their place, and we need to respect the fact that both have their place. And the other thing you have to think about is that fat grafting, I have to get the fat, right? I have to numb up an area, get the fat, numb up the area, inject it. Filler, we can get it off the shelf, right? You just come in, there's not an intervention that needed. So there are pros and cons to everything.
Yes. But the longevity piece, I think,
Sure.
is why I'm more team fat now for sure.
Sure.
But if if you add up, a syringe of filler can be $750 to $1,000 easily. And that is a surprisingly small amount.
Sure.
And depending on
Sure.
where you're getting fat grafting, like the hands, I think we were even talking about the price or something. Like it would be
Yeah.
2,500 or something for filler, which might last you 2 years. I've had filler 3 different times in my hand so far over the last decade.
I hear you.
But I could pay 4,000 and have fat grafting to my hands. It would look better and be permanent. So I think people
Yeah.
have to weigh, because it is permanent, right?
Once the fat lives there, it lives there, right? Once the trauma is gone. Okay. And so, yeah, you look at my patient with under eye fat, it's there for years, decades even, right? And so, exactly right. You had great, you had fantastic results, great brow lift, great fat grafting. And so, even though I didn't do it, I will say that
You
in
weren't
the right
here
place.
yet. I'm
I know,
waiting
I know.
on you. Now you've done my sister and all my best friends.
In the right hands and in the right patients, it can last a long, long time. And so that's why I think it's something worth exploring with your surgeon. And I'll be honest, our med spa sends plenty of patients to me to talk about fat grafting. And I think that's what makes a really good med spa, right? Because once again, you would think that the med spa would be like, oh no, you don't need it. Let's just do filler. But they understand the application of it in the right settings, right? And so they'll send me patients like, hey, This person has under eye hollowness, and I think you should talk to them about fat grafting. And I appreciate
Mm-hmm.
that. Absolutely, right? Because
Mm-hmm.
that's how it should be, right? Circling way back to our first conversation, a good med spa and a good surgeon should work hand in hand together because one cannot work without the other. Truly, a med spa
Mm-hmm.
is limited in what it can offer, and a surgeon's results are limited in what they can offer unless both work well together. Every
Mm-hmm.
single one of my patients that I do a facelift on, I send to the med spa as part of their treatment plan to get a thorough evaluation of their skin quality and then be put on a regimen, not only of medical grade skincare, but then those other modalities, twice a year laser or dermapen or microneedling. I put them all on that regimen, right? My rhinoplasty patients, they all go to the med spa.
Mm-hmm.
Why? Because I want them to have a thorough evaluation of their skin and then be pre-treated, right? Post-treated.
Mm-hmm.
You've had tape on your nose for 6 weeks. All that oil and gunk's built up there. Go to the med spa. They'll help you out. They'll take care of you. They'll
Mm-hmm.
give you a good facial. They'll give, they're lymphatic massage trained. They have red light therapy, which will help with inflammation. And so everything works well hand in hand. We are, I think, two partners in a tango, and we dance well
Mm-hmm.
together because you have to. That's the only way you can get the best results for your patients. It'd be hubris on my part to say I'm the best and you only need me and I can do it. I know my limitations. You have to be able to go to the med spa and keep up your results and optimize them to get the best result.
That was so well said. And it makes me feel good. It just makes me feel like I'm glad everyone has a choice.
Yeah.
And I couldn't agree more. I mean, I just am lucky I get to work with both of y'all. Because if I
Right.
had to pick
Right.
med spa over surgery, honestly, I like both and I need
Yeah.
both. A little bit of this, a
Absolutely.
little bit of that.
For
No,
sure.
it's great. We are living in the best season for this stuff. I'm telling you, as the old
Oh yeah.
lady who saw all the lip implants, because
Right.
that's how we used to do it,
Yeah.
and cutting here because we didn't have Botox. You
Yeah.
had to cut
Yeah.
the muscle to release this. I mean, it was wild. And
Yeah.
now we have you and the med spa. So it's
Right.
amazing.
Right.
I know we didn't cover 1,000 other questions. Is there
Sure.
anything
Sure.
that you get DMs about that we missed? I tried to do kind of face, skin, eyes, neck.
Sure. Absolutely. I think the last, two comments that I'll make is that one, find a med spa that's safe, that has your best interest at heart, right? Find people that you can trust and that they're willing to say no to you. Don't keep going to only people that will say yes and yes and yes and yes, and it's
Mhm.
giving you more and more and more because it helps their bottom line, right? Those people are not there to look out for you. And so you should find a med spa that you trust, has good reviews, your friends go there, have good results, and are people that you'd be willing to send your mother or your sister to, for instance, right?
Mhm.
So that's statement one. Find a good med spa and optimally find one that has some sort of medical provider on board, optimally a plastic surgeon. Okay.
Mhm.
And then the second thing I'll say is that just talk to your plastic surgeon before you begin to make big changes in your face because you think that there'll be quick, easy fixes and quick, easy shortcuts, right? Oftentimes, if things seem like, hey, this is too good to be true, it's probably too good to be true because you're just going to end up regretting it in the long run when it makes my job much harder, your results suboptimal, and healing significantly tougher, right? So
Mhm.
be smart, don't rush into something as a quick fix or a gimmicky thing. And sometimes it's worth waiting, saving up if you have to do the bigger thing instead of spending all this money
Mhm.
earlier on smaller things that are just hurting you in the future. That'll be my
Yep.
last 2 cents.
So good. Well, we are so grateful for your evening. I
Thank
know
you.
you're still
Thank
at
you.
the office. Thank you for staying
Of course.
because
Of
this
course.
was, I got nuggets and I use and love all of this stuff. So I'm sure
Right.
other people did as well. If you guys do have other questions that we didn't answer, obviously you can always message Bustmob, but Dr. Singh is in the
Yeah.
Ask a Surgeon
Please.
group. You
And
can
DM
follow
me.
him on his Instagram. Yeah,
Yeah.
DM him. Dr.singh.amelia. You're on TikTok. You're all over the
Oh,
place.
yeah. All over
So
the place. Absolutely.
thank you so much for this. And this will be
Absolutely.
live on YouTube. And hopefully, people, if they missed it, can watch it later because this was super
Perfect.
valuable.
And thank you for your time. Always great questions. Great seeing you again. And
Yep,
I'll see y'all soon. Thank you.
absolutely. Thank you, sir.
All right. Bye bye.
Bye.